So today we are here to hand over PSA test kits to NCI Kenya for the benefit of the Kenyan population, and also to promote mass screening and early disease detection.
And on behalf of the senior leadership team of Astrazeneca and my colleagues here, we want to thank NCI for the partnership that we have, COWS for the partnership that we are having, and today being a great day for the patients in Kenya. We are excited to be handing over these kits that will go a long way, as my colleague has said, in terms of improving early detection and screening for our patients for prostate cancer. Thank you very much, and we urge you to promote all that it takes to encourage early screening and also to benefit our patients as they come in early, so that in cancer, as Dr. would say, the earlier the better. Thank you so much.
On behalf of the company, let me take this opportunity to thank Astrazeneca, to thank NCI for this partnership. We look forward to providing the kits to the community as we had agreed for the purposes of the early screening. Thank you so much.
Kenya Association of Urological Surgeons, and we'd like to express our gratitude and pleasure with AstraZeneca for providing these prostate cancer screening kits, which will go a long way into alleviating the burden of advanced cancer in this country. As we all know, any cancer, when it is early, has no symptoms, and when it is early, is potentially curable. So by screening the normal population out there, we'll be able to get men who have prostate cancer but are unaware of it, and therefore they will be offered treatment that will hopefully save their lives. A commercial PSA kit test costs upwards of 2,000 Kenyan shillings, and what AstraZeneca has done is immensely a very, very good gesture, because it will help those who cannot afford that get the service. Thank you very much, AstraZeneca.
Good morning, ladies and gentlemen. Yeah, my name is Dr. Elias Meli. I am the CEO of National Cancer Institute of Kenya. We are glad this morning to be before very cordial partners and collaborators, in health in this country and in this continent and in the globe, and specifically, partners that we've walked this journey together in improving cancer care in our country in general. And we are working through a multi-sectoral approach. And while we are working towards reducing the burden of cancer, we do recognize as a nation that the burden of cancer in Kenya is increasing immensely. And we are worried as a country because this disease, is not a respecter of anyone or anybody. Talking about cancer in general before I talk about prostate cancer, the reason why we are here this morning. Globally, the burden of cancer is increasing. In our country, it is increasing, and it's also in our communities and in our villages. And our current approach in this administration through our Ministry of Health is pretty much community health. We are looking at primary health care. We are looking at preventing and promoting, good health and preventing diseases rather than, waiting until diagnoses are made, and we put a lot of effort in curative treatments. Astrazeneca has provided huge support through the big umbrella program dubbed Cancer Care Africa, and we would really want to appreciate that this partnership is broader than what we are doing today. We are privileged on behalf of the country as NCI to receive PSA testing kits this morning, and these kits, we are going to use them for screening for prostate cancer. It's going to be free for our patients. We have received 10,000 kits that will be distributed across the country as an initial phase of the support. And this is going to be continuous as per the discussions and deliberations that we are having with Astrazeneca. And as we promote screening, we would want to reduce, those patients who ultimately get diagnosed with advanced disease. It is cheaper to treat patients when they present early. At the same time, what we save, not only finances, but we end up saving life, which is really important. And it is also, the interventions become less complicated if we diagnose prostate cancer early and we treat it early. So I am calling upon Kenyans that all of us who have an indication for prostate cancer screening to come out in large numbers and utilize this, privilege that we have through the support of Astrazeneca. And we are looking at all men who are 40 years and above. This service is available. We are targeting majority those who do not have any symptoms, of prostate cancer. Commonly, we do know that we are asking men, if you have a challenge with passing urine, probably you are struggling in passing urine, then it means most likely your prostate gland is enlarged. That doesn't mean you have prostate cancer, but it means we should be able to undergo evaluation by an healthcare provider who is qualified enough to guide and advise on additional investigations that would confirm your diagnosis before treatment is advised. You may also be having frequency. You're waking up at night several times to go for a short call. It is important that you seek assistance from the hospital. You may also be having, pain at your lower back. Men ordinarily would not have back pain, but when you present with back pain, it is good that you get to seek assistance. Generally, we have a running statement that if you have low back pain and you are a man more than 40 years and you do not have any history of trauma, you've not been hit by anything, it is good that you seek evaluation, because one of what could cause low back pain could be diagnosed as prostate cancer. And it's because when prostate cancer is diagnosed and it spreads, more oftenly it does spread to the vertebral bodies, which is the bones on your lower back. It is important that we sensitize the community that when you have such symptoms, amongst many other symptoms, you may be having prostate cancer. But this is the group we're asking them to go to the hospital for checkup. But there is a whole lot of Kenyans who are not having any symptoms completely. And we are asking that take advantage of this opportunity to be screened. Our strategy from the National Cancer Institute of Kenya is community approach, community outreach. The equipment that Astrazeneca has supported the National Cancer Institute of Kenya with on behalf of cancer care in the country will be distributed to our 7 regional centers. This is Mombasa. We have that's Coast General Hospital. We have KUTTRH. We have Kenyatta National Hospital. We have Moi Teaching and Referral Hospital. We have Jaramogi Oginga Odinga Hospital. We have Kakamega County Referral Hospital, and we have Nakuru County Referral Hospital. These centers will benefit from an ultrasound machine that is being used to assess the prostate, and if there are features and symptoms from the patient of enlarged prostate, or if it's not enlarged on the ultrasound, through screening picks lesions that are suspicious for prostate cancer, then a biopsy is conducted. And this is done by surgeons who are trained. To thank Astrazeneca again for training our healthcare workers. We had a preceptorship program, at Cairo University in Egypt that Astrazeneca sponsored our urologists, our pathologists, radiologists, and oncologists to undergo a training so that as a team they will improve prostate health and prostate cancer care in our country. And a biopsy would be taken from this prostate gland. If it's diagnosed cancer, then the patient will be directed to care. But then, before we get to diagnose prostate cancer, for those who are in the community, Astrazeneca is providing test kits, and I'm happy our director from microbiology is here today. He is a technical person who is supporting this service. We have a kit that is very simple to use, and this kit, we will draw blood from your vein, and we are going to add reagents on the kit, and we will insert this kit on a gadget, on a machine called a reader. And within 15 minutes, we would know whether you have this protein called PSA. It is called prostate-specific antigen. If it is elevated, then we will ask you to see a doctor who will further advise on what does that mean if it is elevated beyond the normal range. And our normal range is between between 0 and 4 nanograms per dl. If it is beyond that, then we will ask you to be reviewed by a healthcare worker, more often a surgeon, a physician, or an oncologist, and they will guide you. When PSA is elevated, it doesn't necessarily mean you have prostate cancer. I think it's good to allay this fear so that whenever you get a blood test with an elevated PSA, you are not worried. So we are having a comprehensive care. From the community, we are screening you through the support of Astrazeneca, Ministry of Health, through the National Cancer Institute of Kenya, in partnership with CAUS, which we together are undertaking this project. If you have elevated PSA, then we will connect you to care, where an ultrasound will be conducted. If there are lesions suspicious for prostate cancer, we will take a biopsy. This biopsy will be sent to a pathologist who would look at it under the microscope. If it confirms there is cancer in it, then we will send you to care. If you need surgery, you will be assisted by the urologist, who Dr. Mburugu here represents them. You need Dr. Mburugu, we need you here.
You've read my
So I think we need to open.
I will open the door.
Just demonstrate what this means.
So this is the PSA kit for prostate, Dr. has said, and in one box we have 25 tests, meaning 25 patients. The way the test is done, you will withdraw blood from the vein, as Dr. has said. You can use the vein, you can also use a prick from the fingertip. And then you dispense that blood into this cartridge, Once you dispense into the cartridge, the PSA in the blood will react with the reagent which is here. After incubation of 15 minutes, which Dr. has talked about, you insert into the reader, and then the reader will be able to give you quantitative results. Normal values is 0 to 4 ng per ml. Anything above 4 ng per ml is abnormal and requires care, as per what Dr. has said. Thank you.
Great, thank you very much. So, maybe thank you very much. So I think
Thank you very much.
I think this yeah, thank you
for the
very
partnership.
much. Thank you. We really appreciate that. Yeah. Thank you very much. Great. I think that is good enough.